This is Speaking of Pets podcast, where we offer you up-to-date, science-based, accurate information.
Oh, Gizmo!
Good kitty. You're such a good kitty.
And they're looking up and howling in unison.
If it affects pets, we'll talk about it. The Speaking of Pets podcast is sponsored by Blue Buffalo Veterinary Diets. Love them like family, feed them like family. And Vetramax Veterinary Supply. Vetramax makes it better. Hey everyone, welcome to Speaking of Pets. I'm Alice Novotny-Jeroman, a board-certified veterinary dermatologist, and
I'm Janet Novotny-King. I'm the doctor's sister. I am not board certified or doctor or medical in anything. I'm a pet lover and rescuer, and we're here to give you some really good science-based information to help you be better pet owners, be the best you can be. And today we are welcoming Dr. Teller.
Lori Teller. Yay!
Welcome to the show.
I'm so glad to be here. Thank you.
Dr. Teller, where are you?
I am on faculty at Texas A&M University, the College of Veterinary Medicine. And
Are you a native Texan?
we moved here when I was 6.
Oh, okay.
Close.
As long as I've known you, my friend Dr. Garfield from Dallas has a little bit of that Dallas, but I don't detect that.
No, I don't really. I mean, if I say y'all, I say y'all a lot, but
Okay.
I don't
That's
really have
endearing,
the Southern accent. Yeah.
Anyway, today's show's all about vaccines, and I said in the intro, I can't think of anyone more qualified to answer all of your vaccine questions. Why do we vaccinate? What's the premise behind it? Are there side effects? Are there titers? Than Dr. Teller, because this is her thing. So anyway, Dr. Teller, let's start at the beginning. Why do we vaccinate? Why do we vaccinate our pets?
Why do we vaccinate?
We vaccinate so we can prevent diseases that cause severe illness or even death in our pets. And some of the diseases that we vaccinate against are also contagious to humans. So rabies, for example, leptospirosis is another example. And so we also are protecting humans and public health overall.
I have to tell you my lepto story. You know, being in Florida with the 3 hurricanes, and of course we got salt water, but we also got a lot of rain and the rivers overflowed. And so I had put on our local next door, please make sure your pets are up to date on leptospirosis vaccine. Well, I had a woman that just really reamed me a new one. My vet says that's deadly and I would never give it. And how do you even address that? If you've ever seen a pet in ICU dying of leptospirosis, not to mention that we can get it. Janet, you had a human friend that got it. And I hate to use the word ignorant, but that was a totally ignorant comment.
Very.
And Lori, what do you think about lepto? Now, we're
First
supposed
of all,
to do it yearly now.
for us, like normal people here, non-doctor people, what is leptospirosis?
Spirosis. So leptospirosis is caused by the leptospirobacteria, and we just call it lepto because that's a lot easier to say. But it's a nasty bacteria, and it is spread by rodents, in the urine of rodents. So squirrels, rats, mice, your typical urban and rural wildlife, right? I mean, they're everywhere. Rodents.
Is it also in the poop or just the urine?
It's in the urine. It's spread through the urine. And they like to, rodents are not particular. They'll go where they need to go. But they tend to go in moist areas. So certainly after major rainfalls, flooding events, but even people who water their yard. There's puddles and moist, muddy areas there. And rodents use that, and dogs are not super discriminating, and they go walking around. Some dogs eat things in the yard, but even if you have a more discerning dog and who's not eating things in the yard, they still come in and start licking their feet.
Sure.
And so
That's
they can
true.
easily get lepto that way. And way back when, it used to be considered as a disease of hunting dogs because they'd go out, retrieve birds, things like that, get in water. But now the most common dogs to get it are really the small purse-sized dogs, condo apartment dwellers, because they go out walking in urban areas and they are walking through it. And frequently people think they don't need to vaccinate those dogs, and those are the most common dogs we now see it in.
And those are city dogs, which are like New York City dogs, where
Yes.
there's a load of rats.
Oh,
Yeah.
yeah. Yeah,
Oh,
Wow.
definitely. So even if you live in the concrete jungle,
Yeah.
your dog can still get lepto.
and Janet, didn't you know someone when you were living in California that a human?
Yes, a very, very good friend. There were three guys out on a houseboat trip, and they got off the houseboat and they were, hiking. And they showered under a waterfall. And what was upstream were cows. And all three were hospitalized. One was like a day away from going on, I think it was kidney dialysis.
Yeah,
'Cause
right.
Everything shut down. But they all three are very healthy men, like they were marathon runners, the whole thing. And it was terrifying. But that's how they got it. And actually, I think the CDC came in and they had to take them back to where they hiked and blah, blah, blah. So anyway, yeah, that was horrible.
Yeah,
That-
no, it is. It can cause kidney failure and liver failure in our pets. And as
Humans.
you learn through your friends, humans can get it. If
So
we
how
have
often-
a patient come in with it, we have to wear all the protective gear.
Oh my God.
Oh, right.
So how often does your vet, is that part of the annual visit?
Yes. So initially to vaccinate for lepto, you get one injection and then you come back 3 to 4 weeks later and get the booster.
Oh,
And
okay.
then after that, it's annual. And I know people from previous generations, they did think the lepto vaccine made their pet sick. It was very, it could cause a lot of reactions, but it has been completely reformulated in the past 20 years or so, much less likely to cause a problem. And of course, the incidence of lepto has increased. It's in all 50 states now. The American Animal Hospital Association, AHA, used to consider it a lifestyle vaccine, so it wasn't a core vaccine that all dogs should get. And it recently became a core vaccine because the incidence of lepto has increased so much in our dogs.
So is it for cats and dogs?
It's just for dogs.
Just for dogs, okay. I don't think Libby, our golden, I don't think she's vaccinated for that.
Well, you better check it out.
I am.
both
I
of
just put it on
mine.
my
I
vet
keep
list.
reaching down here because I have a golden down here that requires 24/7 petting. But yeah, I made sure that these guys got it before we drove down here to Florida. Because
Yeah.
I got to tell you, I don't know, Lori, if we're checking for it more than we used to, or like you said, the incidence is higher, but boy, is it scary anymore.
It is scary, and I've had patients in the ICU with
Oh.
it. So it's horrible. It's horrible for the pet to have it. It's expensive on the owner's wallet. It's scary for everybody, and it's so much easier to prevent.
So this one is every year where
Yes.
the regular, what we call the DHLPP, distemper, hepatitis, all that, that is what, every 3 to 4
That
years?
one is every 3 years
Okay.
after you're an adult. So
Okay.
you get a series of those as a puppy, just like human babies get multiple as they're growing. But once you're an adult, you get your adult booster somewhere around a year to a year and a half of age, and then you go to every 3 years. And there have been enough studies that show with distemper and hepatitis and parvo that the immune response from the vaccines will cover you for those 3 years.
Oh, thank
So
goodness.
that's really helpful. Because lepto is a bacteria and those other diseases are caused by a virus, how our body and our immune system respond to those vaccines is different, and that's why we have to do it every year.
Okay, so walk us through, I get a new puppy.
Yes.
Oh, good point.
Tell me the whole vaccine. I know what it is with pediatrician stuff,
Yes.
right? But what is it with veterinarians? So I
Right.
get a new puppy.
You get a new puppy. Congratulations.
Thank you. I get to rescue people.
There you go. And so generally, we'll start vaccinating puppies between 6 and 8 weeks of age. And we want to get the major core vaccines, so the distemper, the hepatitis, the parvovirus, is in that first vaccine. What we don't know, and it varies from puppy to puppy and litter to litter, is how many maternal antibodies your dog still has. So the concern with maternal antibodies is it can interfere with the protection the vaccine is giving. And in some dogs, some puppies, the maternal antibodies can start fading at 4 to 6 weeks. Other puppies, it may not start fading until they're 10 or 12 weeks old, but there's no way to know. We don't have a good way to test that. So we want to vaccinate them starting at 6 to 8 weeks, and then we want to re-booster them every 3 to 4 weeks after that until they're 16 to 20 weeks old. And that way we know we've gotten them protected. At some point in there, we overcame the maternal antibodies, and their risk of catching distemper and parvo have substantially decreased.
So during that time, they should not be around other dogs, right? While they're building up their immunity?
Yes, and this is one of the things that as veterinarians we struggle with, because we want them to be protected and not get a potentially fatal illness.
Right.
But we also know that this is their peak time to be socialized and learn good socialization behaviors, not only with people, but also with other dogs. And so we want to balance behavioral issues with protecting from disease. So definitely don't take a not fully vaccinated dog to the dog park, pet store, things where you don't know the history of other dogs that have been there. But if you have friends and family that have a healthy dog that you know is vaccinated, by all means, get them together, let them socialize, let them do all the doggy things, because that will go a long way in helping your puppy grow up with normal behaviors and reinforcing good manners, while also lessening the chance of catching something that could be really
Kind
bad.
of like a supervised play date.
Yeah, definitely.
Supervised with people and dogs you know.
But
Yes.
you also know that that friend's dog has been vaccinated. When you
Yes.
go to the dog park or
Oh,
out
I
on a walk,
know.
it's a
Yeah,
crapshoot.
it
And,
is.
you know, as a pet owner, when you get a rescue, you don't know which end is up, right? You don't know what you're getting. So and pet owners can do this as well, and I would just hold the leash and say, you know what, we just got her. She's a rescue. I don't even know if she's been vaccinated. And then they like run. So,
Good.
I mean,
Yeah,
you know,
that's
because I
great.
don't know about that other dog.
Great. And you
The
want to
other
start puppy classes when you get a puppy too. So when you go to wherever you're going for training, fine to start the puppy class even if you haven't finished the vaccine series. But you want to know that the training class requires all the puppies to have started their vaccine series as
And
well.
that's, I think that's really responsible for you, for a puppy class or even a boarding kennel to show make you show documentation that your dog, I mean, I think a lot of a place like that. I think that's wonderful.
I do too. And make sure they're checking fecal samples for parasites too.
Oh, absolutely. Janet, the other thing that Lori and I, I'm sure, ran into is, well, we're going on vacation next week, and now I've got to get him his kennel cough shot.
Yep.
Well, if he gets a shot today, in 7 days, that immunity is not going to be built up. Would you comment on that, Lori? It's not that fast.
No, it's not. It's going to take at least 2 weeks, if not more, to even start that process. Though, specifically for kennel cough, if they're getting the intranasal or the oral vaccine, they will start building immunity a little bit faster than the injectable kind, because that's local immunity, so it's right there in the tonsils and what have you. So that does help. But of course, the kennel's going to require it, whether the dog's really getting protection or not. And we see this a lot because people are rushing to do it. So even if they're not protected this time, we still give it, because you never know when you're going to go out of town again.
Yeah.
Life gets away from you,
Yeah, just
and
keep going.
and you're in that same cycle again, like, oh, I'm leaving in 3 days. So if you regularly travel or take your dog to the groomer or to the dog park, anywhere where it's going to be interacting with other dogs, then kennel cough should just be one of those vaccines that your dog gets.
Just be current in case you have an emergency. By the way, if you hear munching, it's right here.
Okay.
Atticus chewing. I can hear it from here. It's like potato chips.
Lori, the other thing when you mentioned about how much, compared to 20, 30 years ago, dog and cat vaccines are so much safer now.
So much safer.
Aren't they? And I'm so proud of that, of all the
I am
research in our
too.
profession.
Because we want to protect our animals, and any vaccine has a benefit versus risk. I mean, these are things we're injecting into our animals, and so we have to balance that, which is why we also have core vaccines versus so-called non-core lifestyle vaccines. But whenever we're injecting, we want the vaccines to be as safe as possible. And as technology has evolved, we've been able to improve the vaccines so much. So longer duration of immunity, why we were able to go from 1 year to 3 years for some of these vaccines, but also a significant decrease in the number of reactions. And I think that's important to keep in mind because reactions, that's what scares people, right?
Yes.
That their pet's going to get sick or something terrible is going to happen. And there is maybe 1 in 1,000 dogs that has a reaction. And those reactions, let me even make that more in perspective. There's 1 in 100,000 dogs that will have a serious reaction.
Okay.
So, and that's like the face swelling up and breaking out in hives and getting really itchy, maybe having a hard time to breathe. So 1 in 100,000, that's a really low rate of a serious or major reaction. More dogs will have a reaction, like 1 in 1,000, but that reaction is it may feel tired for 24 hours. It may be sore in the spot where it got the vaccine. Well, we're all used to that as humans.
Sure.
So that is a reaction, but that kind of reaction does not supersede the benefit of what you're getting 24 hours later when all of that goes away.
And it certainly shouldn't preclude them from getting future.
No, not at all. No. Just like if we have a reaction or like tired or pain, our doctor tells us we can take medication, some kind of anti-inflammatory. Well, we can certainly give an anti-inflammatory, send something home with the owner to give to their pet if they know the dog or cat gets tired or feels painful for 24, 48 hours. And then they get the benefit of the vaccine and they don't have to feel bad.
Now, are kittens kind of on the same plan as puppies?
Yes, we may start a little bit later, like 7 to 9 weeks, but the same idea. They're getting boosters every 3 to 4 weeks until they're about 16 to 20 weeks old.
Hey, did you know that Blue Buffalo makes prescription diets that are formulated by animal nutritionists and veterinarians? And they're used for dietary needs such as kidney support, gastrointestinal support, weight management, and our favorite, allergy and skin problems.
They make a food allergic diet that's an alligator based called NP or a hydrolyzed salmon based for dogs and cats called HF.
So please ask your veterinarian about Blue Buffalo prescription diets.
Now there's soothing relief for your pet's irritated skin from allergic response, contact allergens, and insect bites. Atopicreme HC by Vetramax is a unique anti-inflammatory, rehydrating leave-on lotion conditioner for animals that is quickly absorbed, providing sustained benefits while leaving no residue. Fortified with ceramides, these lipids help restore the skin's natural protective barrier and aid in healthy skin regeneration for your pet. Atopicreme HC is made in the USA and not only provides quick relief for irritated skin, but it's also an aid in detangling your animal's coat. Ask your distributor about Vetramax products. Vetramax makes it better. Wow. And on that note, Lori, would you comment on, people would always ask me, well, wait a minute, that's a 1 cc injection. You're giving that to an adult Rottweiler and you're giving it to my 5-pound poodle.
Right.
They ask you, well, can't you just give them part of that?
Mm-hmm. That's based on weight.
Yes, that's a really common question that we get. And the thing to remember is vaccines are not drugs. So they are not based on weight like your common antibiotics or pain medicines are. Vaccines have a concentration of antigen or virus that will stimulate your immune system. And your immune system is not different whether you're a 5-pound Chihuahua or a 100-pound Mastiff. It takes a similar level of that virus or antigen to stimulate your immune system. So everybody gets the same dose.
It's the dosage.
Yeah.
Right. Okay, so what about Is it called the Lyme vaccine?
Yeah, to protect against Lyme disease.
Yeah. And
Yes.
it's 50%-ish effective. Is that true?
I'd have to look and see what the latest data is on it. The thing with vaccines like Lyme is it may not actually prevent you from getting the disease, but it will help prevent you getting the clinical signs of the disease. So the dog could get bit by the tick and have Lyme, but if it can prevent the progression to kidney disease, muscle disease, those kinds of things, because Lyme is obviously a pretty nasty disease in humans and in dogs. So we want to do what we can to at least lessen that.
To me, that's worth it. And then also doing the topical tick stuff.
Yeah, I
Or
mean,
is it a pill that you give me? Whatever I give that dog.
yeah, you definitely want to prevent the ticks in the first place, right?
Somebody's topical and somebody's oral, whatever. Yeah.
They both work.
They both work.
Yes.
Huh.
What
Yes.
about, I don't know how you feel about this, Lori, but I always hesitated about giving all vaccines at once. Like if I had to give a dog DHLPP, I'd say, you know what, let's do this today, and then in 2 weeks, why don't you come back for the rabies? What's your opinion on that?
And I think that's a great point. And there are actually studies that show that dogs that weigh 20 pounds or less
Okay.
are more likely to react if you give all the vaccines at one time.
Okay.
So for smaller dogs, I'm a huge believer in breaking those up. So they may come in, when they're 8 weeks old and get their distemper parvo vaccine, and then break that up, and when it's time to give the lepto, give that separately, and then space that out and give the rabies at the time, so they're not getting all of those at one time.
Right.
The bigger dogs, Great Danes, Labradors, things like that, they, for some reason, tend to be less sensitive to that. And so I don't usually break those up unless they've had a previous problem. If I know a dog's had a problem, felt bad, something like that, then I'll break it up, whatever size it is.
Are some breeds a little more susceptible to those reactions?
So it's interesting. It's not necessarily a breed overall, but genetics definitely play a component.
Interesting.
So certain lines in those breeds may more likely react to the vaccine. And so to me, it always makes me a little bit nervous when a breeder says, never give lepto to your dog. I mean, that's a major overstatement, especially without even looking at the dog's lifestyle. But it concerns me because if that breeder's particular line is having a reaction to a vaccine, then they probably shouldn't be breeding those particular
right.
dogs.
Good point.
Yeah.
Because a breeder is a doctor of veterinary medicine. Just had to slide that in.
We hear that. Yes. And I always want to say, and where did you get your DVM
Oh,
degree?
I know. We think it, but we don't say it.
Right. Right.
And
Yes.
for pet parents that were very, very nervous, oh, what if they have a reaction? Blah, blah, I would actually have them sit in the exam room, bring them a magazine, and say, "Hey, hang out here for an hour. This way, if you won't be in the car on your way home."
Right.
Well, speaking of which, what are some of the common lesser side effects that you could see?
Well, what are the reactions? Like if I'm
That's
driving
what I
home
mean.
with the dog,
Decide-
what
yeah.
am I looking for?
So beyond just pain, localized pain and inflammation, the ones that people really worry about are the dog stops breathing because their throat swells shut, or their face swells up and it becomes really red and they become super itchy. They may get hives all over their body. Their skin turns red, and that does need to be addressed. So if you notice that happening with your pet, then it needs to be addressed. So either come back and see us as soon as you notice it. If it's after hours, go to your local emergency because we do want to treat that and address that. And so those are the things that scare people. rightly so. They're just not as common as people think. And so, Alice, I love your plan of having the client sit
Yeah, hang out
for
for a
an
while.
hour. Yes.
Yeah.
Sometimes people can't do that, and then I'll say
Sure.
either please leave the pet with us and go run your errands, do whatever, and we'll watch your pet and come back and get it when you're done, or make sure somebody's going to be at home to watch.
Having said that about leaving the pet, reminds me, one day I had a couple that came in, and I had been seeing them for something, and they brought two dogs in. And the gentleman, I looked at him, I said, "Are you okay?" And he was like, "No." And I thought, oh, geez. So
Oh, my God.
we called the squad, and they took him. And so I had them leave the pets with me while she went to the hospital with him. But here, thank God it was a kidney stone. So,
Oh, phew.
but I digress. But
You're right.
Now,
Yeah,
what
but
about?
wait a minute. When my human son and husband would get their allergy shots, you have to sit there for 30 minutes afterwards.
Right,
Which a couple of times when I was with my young son, I was thrilled. He was unaware, but I'm kind of watching him like, is anything blowing up over there?
Right.
Yeah.
It's
Yeah.
comforting.
Well, speaking of that, what do you say, Lori, when people come in and say, "Well, I don't want you to give them the vaccine. I want you to do a titer, draw blood."
I was going to ask that.
Feeling about that.
Because, okay, so Lori, I had Lyme and found out through all this blood work, they do all this, and I found out, the doctor looks at me, he goes, "Oh, you had Epstein-Barr. When was that?" And I'm like, I don't know.
Actually,
never
Lori,
diagnosed.
she had Lyme and Bartonella.
Oh, yeah.
She's
Wow.
in Connecticut. So.
I wear a sash now.
Yeah.
Yeah, you should.
Lyme and Bartonella survivor.
And survive.
But seriously, that from all
That's
the titers,
scary.
whatever the blood work,
Yeah.
would tell me you had this and
titers,
this and this,
right.
and I'm like, I did,
Right.
right? So can you test an animal that way?
So we can do vaccine titers.
Okay.
And for some vaccines, they're very good. Distemper and parvo in dogs is excellent. For feline parvo, which is panleukopenia, excellent. The herpes titer is in cats. It doesn't give us the full picture because we have essentially two major immune systems in our body. One's called humoral and one's called cell mediated, and I won't go into all the science behind it. But when you are measuring titers, you're only measuring one half of our immune system. And so if we get a positive titer on that, we can feel pretty good that a pet is protected, but we don't really know how the other half of the immune system is going to work if you're exposed. But it can give us some level of comfort. So for people who may not want to vaccinate their pets, maybe the pet has a autoimmune disease, and so we're trying to lessen immune system stimulation, then checking a titer in those pets may be a better idea than just vaccinating. But again, that's going to come down to the dog's health status and its lifestyle. So if it's a dog that is running through rodent-infested areas or frequently hiking, those kind of things, you're probably better off vaccinating. But dogs that may have a health condition, checking a titer. The caveat to that is no state will accept a rabies titer in lieu of vaccine. So it doesn't matter what your rabies titer is. If you're a pet, you still are going to need to follow the law in whatever state or community you're in.
Pet owner, that makes me feel good.
Yeah, there are some states you can get a waiver for your specific pet, but it's not just going to be because you had a titer. There has to be a lot of other things going on.
I wonder if airlines, because you're seeing all these dogs on planes now and cats, I wonder if they require proof of rabies vaccination and just vaccines in general. I wonder if they do. I have no idea.
So the ones that I have had to fill paperwork out for, they ask about rabies, but I know there are plenty of dogs that are flying that nobody's asked me for a proof of vaccination or a health certificate or any of that. So I would say that some airlines do, and that they're hit and miss. But I would certainly hate to be checking in at the airline desk at the airport and have them ask for proof of rabies and not be able to provide it.
Yeah.
They're not asking about the other
I
vaccine.
bet there's an app for that as a pet owner.
There could be, but it'll ultimately say check your airline's website for the latest
So I just heard this. I'm filing through my good old fashioned Rolodex.
Uh-huh.
Because I heard on the radio today. I know I still use Rolodex.
You know what? I love a Rolodex. I love doing this through it.
Okay, Duke, our producer, is going to pee his pants when I tell this story.
Okay.
So I'm at work one day, and they had the tech guy come in to fix something on my computer. And I put my coat on, and I go, look, everything you need to know, all my passwords are in the Rolodex. And the guy, the 12-year-old, literally goes,
What?
He didn't know what that was.
and I went,
You have a covered one. You have a covered one.
I do, but when I was doing interior design, I had a big, like this one.
Yeah.
I never had that one.
But here's why I'm rifling through it. Today I heard on the radio that one of the chip companies went out of business. And I don't know who my pets are chipped with. I forgot.
Oh, it's not that one, Janet, because you got it from Golden Treasures in Akron.
Yeah.
And I checked. They
But
use a different one.
all your info's gone.
Yes.
Yeah, but that was, I'll tell you, that was a company, I had never even heard of that company. It's not one of the more
It
common.
wasn't one of the more common ones, but you can check. So AHA actually maintains a database, and so anyone who was registered with this one that just shut down,
Good to know.
yes, should
AHA is what?
Immediately-
American.
American Animal Hospital Association.
AAHA.
Yeah.
Janet.
And you can just Google AHA microchip database.
Oh, okay.
Cool.
And if you were registered with this other company, you can just put your information
Oh,
into
that's a great
the
good
AHA
idea.
database.
We might want to put a PSA on our page about that.
Yeah, about
Yeah.
that.
Go here because I heard that I'm driving and I'm going, oh God, what did they do? What company was that?
Yeah. It wasn't one of the major players,
Right.
like
But
Home
you-
Again, Data Mars, all of that, right? But you
But
don't
all
know.
your stuff is gone.
Yeah,
Mm-hmm.
it's gone.
It's terrible. They said you can call and get it moved or whatever, but I was like,
I'm
oh my
surprised
God.
they didn't sell it to another company. Anyway, what about vaccinating elderly pets?
Oh yeah.
'Cause
Yes.
I'll have a pet owner that comes to me and said, he's 14, we don't give him shots
He doesn't go
anymore."
outside. Yeah, all that stuff.
So if they're healthy, they're most likely going to be protected, at least if it's been since 3 years ago. But we also know one of the things that happens when we get older, and lots of things start to deteriorate and not quite work as well as they used to, and that includes our immune system.
Right.
So it's still a good idea to maintain that every 3-year schedule, or at least check a titer and see what your
Okay.
pet's titer is. Because the last thing you want is your pet to have another condition that's weakening its immune system, and now your pet's been exposed to parvo, and you get parvo on top of your kidney disease or heart disease or whatever. Yeah.
Hey, did you know that Blue Buffalo makes prescription diets that are formulated by animal nutritionists and veterinarians? And they're used for dietary needs such as kidney support, gastrointestinal support, weight management, and our favorite, allergy and skin problems.
They make a food allergic diet that's an alligator based called NP or a hydrolyzed salmon based for dogs and cats called HF.
So please ask your veterinarian about Blue Buffalo prescription diets.
Now there's soothing relief for your pet's irritated skin from allergic response, contact allergens, and insect bites. Atopicreme HC by Vetramax is a unique anti-inflammatory, rehydrating leave-on lotion conditioner for animals that is quickly absorbed, providing sustained benefits while leaving no residue. Fortified with ceramides, these lipids help restore the skin's natural protective barrier and aid in healthy skin regeneration for your pet. Atopicreme HC is made in the USA and not only provides quick relief for irritated skin, but it's also an aid in detangling your animal's coat. Ask your distributor about Vetramax products. Vetramax makes it better.
So you did talk about some intranasal vaccines.
Oh, right.
So as a pet owner or as a veterinarian, can you do, are all vaccines available both ways?
No. Good question. So the one that's commonly available as intranasal or oral is the Bordetella vaccine, the kennel cough vaccine. And some of those will also contain parainfluenza, which is a virus that causes respiratory disease. And so those are administered either intranasally or orally and protecting against the kennel cough. The common cause is a kennel cough. And those need to be given every 6 to 12 months as well.
Wow. So you used a word before about I'm going to say it, leptospirosis.
Uh-huh.
So when I had Lyme, they were called spirochetes.
Spirochetes, yes.
Spirochetes, that
Yes.
thing.
I'm sorry, Lori.
That's okay.
You're
That's
right.
okay.
But is that related?
So
Spiro-
lepto is also caused by a spirochete, but
That's
not related to Lyme. Two
right. The
different.
spiro part was the
Yes.
familiar.
Janet,
Okay.
I'm giving you credit. That was very smart cookie of you.
Thank you.
Yeah.
Our Daddy used to say,
Smart cookie.
well, no, and that's those medical terms that you all speak like Latin,
Right.
which is Greek to me. It just connected to me when you said leptosphere.
Yes.
But you know what?
Ooh, good.
There must be something. Spirochetes are like nasty little.
Yeah.
You know what I mean?
I don't like
they
them.
just, they're
I have
shaped like that, and like they want to drill through things,
Yes.
organs, and horrible
Yeah.
stuff.
And I
Yes.
have to say, when I had Lyme and I'm reading about it, Alice sends me this book and I'm reading about it, and I'm like, oh my God, they're all through my body. Like it freaks me out.
Yeah.
Because they just go crazy. And they
They
go
do.
and scary
They're
little buggers.
they're scary diseases, so that's why we want to prevent them.
Lori, I'll tell you my unique story, but what's the most unique story you've had regarding vaccinations in a dog or cat? Or like a reaction, or you know what I'm saying? That
yes.
you think
like
of when you're ready to give that vaccine.
Yes. So, I mean, probably my scariest one was a puppy that came in for its second vaccine. New client, amazing client, such a sweetheart guy, and it was a little Shih Tzu, and I vaccinated the distemper hepatitis parvo.
The first one?
It was, well, the breeder had given one, so this
okay.
was the second one, but my first time to give it. And the client is checking out, paying, and the dog just turned white and passed out. I mean, thank God they were still in the clinic. And so, of course, my front desk person comes rushing back with the puppy, and we had to put it on oxygen and give it all the things to bring it back. And that dog went on to live to be 16 years old. Amazing, amazing dog. And what I also want to tell you, because when they're freaking out that their dog is reacting, when we know they react, there are things we can do to protect against future reactions.
Yeah.
So this dog still continued to get vaccinated for distemper and parvo, but we knew that we had to give some medications ahead of time
Yes.
to lessen that chance. And of course, we made him watch the dog for an hour. A great dog, great client. I mean, went on to have several more dogs for me to take care of, but he always said when he came in, he's like, we just love you so much. You saved our puppy, right? And so instead of blaming me, the dog reacted, because I have no control over if a dog reacts to a vaccine or not. He was like, thank you for being there and saving my puppy.
I like this client already.
Yeah. Oh, he's amazing.
You
Amazing client.
probably dwelt on the fact that, oh my gosh, I made this dog. Yeah. And he's looking at you. Oh my gosh.
Right. You
Hey,
just
speaking
saved my
of
dog.
which, what do you think about when breeders vaccinate? Give me your opinion on that. That
I
scares
was
me.
going to ask that because what if you get, like, I have a rescue and I really don't know her life,
Yes.
right?
Yes.
So what if I bring her in and you're like, I have no history, kind of like an adopted human, right? I have no medical history. How do you handle it? Can
Well,
you,
Janet, even if they do bring the history in,
how do I know?
Yeah, you don't. You only have what you have to work with.
Yes.
So I'm not a huge fan of breeder administered vaccines. I know it happens. I prefer when they're administered by a veterinarian. Not because I don't trust a breeder to give an injection, but I mean, a lot of people.
Well, they're not a doctor.
They're not a doctor, but I don't know how the vaccine has been stored.
right.
So they're ordering it from somewhere. Is it sitting on their front porch while they're at work for 8 hours? So it's not kept at the appropriate refrigerated temperature. Do they pull up a bunch of vaccines at one time and let them sit for 3 hours as they go about things? Because we know you should not
Right.
have a reconstituted vaccine that goes for more than an hour without
Right.
being used. And if there is a reaction, are they prepared to deal with it?
Yeah.
Like
So
that Shih Tzu. How horrible would
yes,
that have been?
it would have been terrible.
Oh,
So those are the big things that concern me. I know with our vaccine, they're shipped to us while we're open
yeah.
with all the ice packs and refrigerated
Right.
stuff, and my staff puts them immediately into the fridge.
Yeah.
And so I know that they've been appropriately handled from start to finish. And we don't draw them up and let them sit around. We draw them up, give it to the patient, and go on. And so I can just feel much more comfortable
You
that
know,
way.
it made me think of when we had Smudge, the diabetic cat. We had to refrigerate that stuff.
Yeah,
The insulin.
the insulin.
Yeah, and I had to do the whole thing.
Yeah.
Yeah, I forgot about that. And I know I refrigerated it, right? I
Right.
know I didn't lose power.
Right.
And it did come with the whole ice pack. Yeah.
Yep.
But
Right.
you know, Janet, that also goes to the reason of why you should buy heartworm preventative, flea and tick preventative from your veterinarian, because we get it from the manufacturer. It's
Right.
not counterfeit. We know how to
Right.
store it, and
Right.
I get that people. If it's probably too good to be true. If you can get this at a reduced price, if you remember, Lori, someone was prosecuted for selling
Oh, yeah.
counterfeit heartworm preventative. And
Yep.
think of how many dogs probably came down with heartworm because of buying this counterfeit preventative.
Oh,
So
right.
sad.
Yeah.
So sad.
Definitely, you want to know where your product came from.
Yes.
Yeah. And if you buy the product from us, it comes with a guarantee. So if you
Right,
buy
that's
heartworm
true.
prevention from us and your dog gets heartworms while on that prevention, and we can show that you bought it so you never miss doses,
Right.
then the manufacturer is going to cover the cost of treating the heartworms.
I totally forgot that, but you are
Yeah.
right. They stand behind their product.
Yep.
Right.
Wow.
But they have to know where it came from.
Yeah.
That it wasn't a black market or counterfeit product.
I have to tell you, my vaccine, well, I had two. When I was in general practice, I vaccinated a kitten, and it just literally went limp in my hand. And that is a very scary moment.
Oh, yeah.
You know, what you gave that patient maybe killed that patient, but then he just came back like that. And then, of course, subsequent vaccinations, I think we gave him Benadryl before that. And I also switched the manufacturer of the vaccine to see just a little bit different, might have been tolerated. But I did have the cutest little poodle, miniature poodle you'd ever want to see. And every time that dog got any vaccine or any injection for that matter, everywhere on its body that it had previously gotten a vaccine or shot lit up like a Christmas tree with redness.
You
Wow.
mean like the injection site?
Yes, it had all
Oh,
like
weird.
huge red big patches of what we call erythema all over it. So when she ended up moving to California, and so I wrote a letter on her behalf. I said, "Listen, this dog is like, it was a white one, you know, and for some reason, yellow labs, light colored dogs are like the blonde haired, blue eyed child. They seem to be more reactive. But anyway, I had to write a letter about, it can't have rabies. You got to do titers, blah, blah, blah. But that was one patient in 35 years.
Wow.
So
Yeah.
it is rare.
It
Yeah.
is super rare. Yeah.
Yeah.
I mean, it's not great for the one that it happens to, but
Right.
we still have public health and all the other ones to consider about too. So,
Janet and I don't tell many people this, but our mother raised us natural hygiene. We were never vaccinated for anything.
oh, wow.
Still here to
So-
tell you about it. And I'm going to say this, which is like really not PC right now. Also had unpasteurized milk.
Oh yeah, we went to the farm and
Yeah.
raw milk and unfluorinated water. So then when I went to vet school and I had to be vaccinated for rabies,
Right.
I got pretty sick on my first one
I bet.
because my system never saw anything like that.
Right.
Now, Janet, you had polio vaccine because you had children.
Well, and let me tell you, the pediatrician in California, I said, Dr. Lori, there's something I should share with you. Because my first son is like an infant and they're going to get, I've never been vaccinated. And she's like, whoa. And like she called the CDC, whatever. And she vaccinated me with injection for polio because my son Kyle was having the live injection, which would then be in the diaper. So it was like The poor
thought it was
pediatrician.
oral. I remember it
It was
being.
oral. Kyle's was oral, but mine was injected.
Oh, okay.
No.
'Cause I was, 30 some years old.
Yeah.
So yeah, but I got injected. But oh yeah, that's a shocker when you tell doctors.
Oh yeah.
They're like,
See, if anyone shouldn't believe in vaccinations, it would be me and Janet. But
Sure.
these dogs here and my cat at home, they get all their vaccines because I didn't tell you, Lori, but we rescued a little puppy that someone must have dumped at the grocery store. And this was when we were first married. I wasn't a vet then, and it ended up having distemper. And it was one of the worst things I've ever seen. To see that paralysis, and it would just
Yes.
howl. And I remember calling the local vet like at 11 at night, and I remember his last words to me were, "It sounds like distemper." And they have to put a puppy to sleep
Yeah.
before it
Yep.
had its whole life ahead of it. I still can't. It
No.
still chokes me up.
Horrible disease.
People,
Horrible.
whatever you do, vaccinate these animals, and especially lepto every year. Lepto is, Lori, once they get lepto, we don't have dialysis in veterinary medicine commonly.
No. Very, very few and far between to find places that do
Horrible
dialysis.
death.
well, and I will tell you, my friend who got lepto, he was probably in his 30s when this happened.
Yeah.
Is he couldn't urinate,
Oh yeah.
Right.
right?
Right.
And so, but one of our friends took him one of those like portable water fountain things to make that trickling sound to like make him poop. And we were all like, we go to visit, we're like, why do you have like in the hospital room?
Did it work? I'm curious.
Well, and then he peed, and then he didn't have to have the dialysis.
Maybe I should have just drank a lot of beer.
Yeah.
Oh
there.
no, he wasn't allowed to have alcohol. But it was
That's
funny
right.
because we're like, why do you have like this fountain in your? When you think about it, it was a smart concept.
Yeah, exactly.
He goes, well, they're helping the trickling, and I'm like,
Yes. I've never understood that. You go to a spa and you get a massage and you're laying on the table and the background noise is always like a waterfall or rainfall. And I'm like, that just makes me need to go to the bathroom.
Pee your pants.
Yeah,
or
exactly.
it's that annoying like ding 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 ding
Yes.
ding music.
Oh, I
I'm
hate
like,
that. I hate
I hate
that.
that. I hate that.
There's
Yeah.
too many ding dong. You know what? My housekeeper, that she's retired now, Aniko from Germany. We had the driveway, because it's a long driveway, so we'd have the, bing bong. She'd go, "What is bing bong? What is bing bong?" So we always say that when something comes up, we go, "What is bing bong?" And
Oh,
there's
you
so
know when
many
someone
bing bong.
pulls in the ding dong? Well, we now have Simply Safe, Alice, thanks to you,
Yeah.
on all our doors.
Uh-huh.
I'm surprised the dog has not caught on to it. Because
Oh.
every time a door is open, it goes ding dong.
Right?
That's
Yes.
really- and I mean, that's the garage door,
I
like three
know.
different doors. But she hasn't figured that out. Like somebody's.
Oh, my dog does. As soon as she hears the door, she's like, and he goes to see what.
Dad's
what
home,
it is.
mom's home, right?
Yeah, exactly. Dinner.
Yeah,
Yes,
that's
our
right.
golden from day one. I now say, let's get the paper because we get the
yeah.
New York Times delivered, and she's like, paper, my job, my job, like right at the door. It's hysterical.
That's so
They
cool.
are.
Sometimes my husband will throw it because it's on the other side of the electric fence line in the morning.
Oh.
And so my husband will throw it up to the door, and then I'll look at the door, and she's like, blue bag in her mouth, like, got it. It's like a comedy
God.
show around
Yeah,
here.
oh, yeah, that's awesome.
See, he's done eating. See,
Oh,
so
good.
now he's retired. Yeah.
Hey, Janet, I didn't tell you, Dr. Teller's husband's a human dermatologist.
Oh, yeah.
So don't be pointing out any of things and acting what they are.
No, growing up with Alice as the little sister,
Uh-huh.
she was always a digger and a picker.
I
I was not surprised. Like, you got to let me at that. Right, always coming at
No,
you. So
I
was
have no
not
interest
surprised.
in human dermatology unless we compare it to veterinary dermatology. Because
Yes.
Mother used to say to Janet, she'd say, "Alice, would you look at this?" I'm like, "No." She said, "Well, you're looking at dogs' behinds all day." I'm like, "That's exactly right, and I
Exactly.
prefer to do that."
But she would cut, like
Humans
there's
are
a good one.
gross.
Yeah, she was a digger and a picker. So when she
Yes.
did dermatology, I totally got it. Totally made
Oh,
it.
yeah. No, my husband has actually done some comparative derm.
Oh, I love it.
CE with a veterinary dermatologist.
Yes.
They'll go speak to, because we're in Houston, and so there's multiple medical schools with
Yeah.
residencies, and they'll go to the residence rounds and they'll do comparative derm for the
Oh,
residents.
cool.
Talk about human versus animal and all that kind of stuff. So,
I love my dermatologist because I'll be like, well, what's this? He goes, some people grow them.
You know, I have to tell you, of all the specialties, they are the most down-to-earth people. Something about human dermatology, I don't know what it is. I have to tell you my story. Part of my training was done at Metro Health Medical Center in Cleveland with the human medical, students. We were on rounds. And Dr. Paul Hazen, who's one of my favorite people, he's a dermatologist in Cleveland, he would be there teaching in between us going in the rooms and looking at patients. And there was me hanging on every word. Okay, this is the epithelium. What are the diseases? And everybody else was like, they didn't care. It was the most interesting thing to me. And I thought to myself, you guys should be watching this. I know you're not going into derm, but derm, people are going to ask you what this stuff is going on. Yeah.
Isn't it the largest organ on your body?
Yes.
Right?
Yes. And the dermatologic manifestations of internal disease, I mean, so many things that happen inside us.
So cool.
Signs on the skin. Yeah.
Okay, so how did you meet your husband? Was it over like a good
Oh,
rag?
yeah. How did you meet
Or
your husband?
zit? Or blemish?
We met on an airplane when we were 15.
What were you doing on an airplane when you were
We were
15?
strangers. We were going to a statewide youth group convention. We were in high school.
Oh.
And so it was over the December break. And we
Different
we
high
were both-
school.
Different high schools. We were
Okay.
both from Houston, but Houston's a big city, so different high schools. And I happened to get on the plane with a friend of mine who knew him, and he was
Okay.
already sitting on the plane. And my friend said, "Oh, do you want to sit with Craig? I know Craig." And I'm like, "Okay, sure, whatever you say." And so
right,
we
whatever.
sat, and she introduced us, and that was it.
There you go.
Yeah, and
Janet met her husband on the train. Janet picked him up.
really,
Yeah.
The New
Well,
York.
but we were on the train between Connecticut and New York. It's a commuter train, right?
Sure,
Like
yeah.
it runs
Right.
all the time. And we were the only young people. We were in our late 20s, and everybody else was like this age, right?
Right.
And they didn't really talk. And so the two of us just started talking, and we'd see each other on the way home. And back in the day, it was the cutest thing. It was a gentleman with a little bow tie, and he had the bar cart. And you could get any cocktail you wanted, and that guy would mix that thing up so fast because you're literally going, oh, the beer and pretzels, and you're throwing the money in the jar like it was fast. And so Donald and I would then get beer and pretzels, and we'd run into each other, cocktail hour on the train. I got an hour, right? Yeah. And we'd start talking, and that was how we met each other.
Oh, that's so cute.
Wow.
So cute. Yes.
Then we moved into Manhattan. This is even funnier. And it ended up the guy I was dating, because we lost no cell phones, we lost track of each other.
Right.
The guy I was dating, who was lived across the street in all of Manhattan
Wow.
from my husband.
Wow.
Look at
And we ran
you.
into each other at the bodega at the Spanish grocery store. So,
How funny.
small world, right?
It is, definitely.
Strangers on a train or plane.
On a plane. That's right. Yep. And we've been together ever since. So, yeah.
Since you were 15.
Yeah.
Okay, so Lori,
Yes.
this is what we ask all our patients, our guests. I'm going to sound like a doctor.
Now she thinks she's a doctor, Lori. See,
Right.
this is
I
what
see that.
happens.
She's a therapist.
Yes, that's right.
Far from it.
That's right.
I'm more of a snap out of it kind
Needs
of guy.
therapy, but go ahead.
So what is your pet or human peeve? Like what just gets to you?
Oh, whining. My son will tell you this. He'll start whining, and I'm like, "What is my biggest pet peeve?" And he's like,
How old is he?
Whining. Well, he doesn't do it anymore. He's 31. But
How did you stop the whining?
I just ignored it. I'm
Snap
like, it's
out
not
of it.
helping you. Exactly. I'm like, pull up your big boy pants and let's move on. Because you're not getting whatever it is you're whining about. Because
So Lori, I have two sons, and growing up, I would not allow eye rolling. If I said something or somebody said, I would not allow eye rolling. I said that is so rude. You don't do it. And our now passed away kindergarten teacher, Mrs. Matthews, was amazing. And if some kid came to her and said, "I'm bored," she would say, "Have you read every book? Do you speak every language?"
Right.
And so they were never allowed to say they were bored.
Yep, which is great.
No, bad word. It was like a bad word because that's bullshit, right?
It is. I mean, you should
this
learn
is
how to
what-
entertain yourself if
Yeah.
Figure it out.
yeah. Especially for 5.
So that whining to me is like saying I'm bored, right?
Oh,
Yeah.
yeah.
Ooh.
I'm with you on that one. That's
Yeah.
terrible.
No, just no.
Snap out of it.
I don't do whining. So yeah.
Tell us what brings you passion at work.
Oh, well, so I was in private practice for a really long time, but now since I'm at the vet school, I'm teaching veterinary students on the clinic
cool.
floor. So their last year of vet school, and I love, love, love seeing that light bulb turn on.
Oh, I love that.
When they grasp whatever it is that we're talking about, and it could be how to treat a superficial bioderma or whatever it is. But when you just see it click, because then whenever they see something like that, that they got it. They
You
totally
did a good job teaching them.
Do you cry when they graduate? Because I would. It's like your children.
It is, but no, I'm one of those people that's really happy when somebody has accomplished a goal.
Yeah.
So, even if I have a colleague that I've worked with for a long time and would work with forever, but they have a better opportunity,
Oh, sure.
like, go. So that's kind of
Yeah.
how I see the students is I've done my part and now you're going and you have your own
Yes.
journey. And so,
Leaving
no,
the
it makes
nest.
me really happy.
Well, thank you so much, and we
This was
appreciate
great.
the
I-
amazing
So thanks
work
for
you
having
do.
me. I appreciate it. It was a lot of fun.
It's so much great information. People have so many questions about vaccines, and sometimes we don't always have the time at the appointment to go over all this stuff. So they can listen to this when they walk or whatever. I mean, every morning when I go on my walk, I put a webinar on or I put a podcast on.
Sure.
And it's such a good use of time. So
Absolutely. And you should never be bored because you can always educate yourself and learn something new.
I'm
Don't
bored.
say that word. It's like a four-letter bad word.
Quit
Now, I
rolling
have
your
one
eyes.
question. Is your son in veterinary medicine?
Not at all, nor in human medicine. He was like, no, I'm out. Thanks. Which it's fine. That's not how his brain works.
Right,
He's much
right.
more hands. He's a welder. So,
Oh, that's cool.
yeah, super cool. Yeah.
Okay. So
Thank
listen-
you so much.
Oh,
Thank you.
this has
It's
been
been a
so much
pleasure.
fun.
It's been a pleasure.
So Janet,
Yes.
let's close it out. This is Dr. Alice Novotny-Droman from Cleveland, Ohio, and
Janet Novotny King, Cleveland, Ohio native, saying thank you for listening. We appreciate you. Take good care of your pets. Give them an extra treat from us and a kiss on the lips. We love
make
them all.
sure they're vaccinated.
Amen. Bye.
Bye.
Thanks for tuning in today. We hope you learned some valuable information about making decisions about your pet's health.
And don't forget to follow us on social media and subscribe on podcasts because we love to have those likes. Thanks so much for listening.
That's actually really good. You could both go bye-bye.
Bye-bye.
Yeah.
How about woof woof?
This episode of Speaking of Pets podcast was sponsored by Blue Buffalo Veterinary Diets. Love them like family, feed them like family. And Vetramax Veterinary Supply. Vetramax makes it better.
Follow us on social at Speaking of Pets and listen wherever you get your podcasts.
The Speaking of Pets podcast is an SLA video production.